Welcome, everyone. I'm your host, Steve Misek, and today my guests are family nurse practitioner Elizabeth Simkus, DNP, and clinical health psychologist Rebecca Wilson of the Rush Prevention Center. Thank you so much both for joining us today.
Thank you for having
Thanks
us.
for having us.
And before we get started, I just want to encourage everyone watching to share their questions for our guests in the comments. We will make some time to ask the best ones at the end. But to kick things off, will each of you tell us a little bit about your roles at Rush and about the Prevention Center?
Sure. Yeah, I'll start by just kind of explaining who makes up the clinician team of the Prevention Center. We have Dr. Laura Zimmerman as our medical director. She's board certified in internal medicine and a primary care provider, and also certified in lifestyle medicine. We also have a preventive cardiologist, Dr. Phil Leapson, and 3 behavioral health psychologists, Dr. Rebecca Wilson, who's with us today, Dr. Brad Applehans, and Dr. Amanda Matthews, which Rebecca will touch on their roles in just a second. But I am a family nurse practitioner, and Dr. Zimmerman and I practice lifestyle medicine. And what we do is, we do one-on-one visits patients. And our first visits with them are about an hour long. Our follow-up visits are about a half an hour long. And we do chronic disease management, prevention, treatment through lifestyle medicine techniques. And we also have a Facebook group for our patients. So we will post recipes, we interview other specialists throughout the health system, and put tips and other ideas out there to keep patients engaged in between our visits.
And
Great, Rebecca.
so I'm a clinical health psychologist. A lot of times when new patients come to see me, they have the question of what is a clinical health psychologist? And basically, we have clinical training, but we work with a lot of people on health concerns specifically. So we learn a lot about what creates behaviors, how to create behavior change. Myself and Dr. Brad Applehans, we both work with a lot of people who want to manage their weight. And Dr. Amanda Matthews, she will work with people who are trying to reduce or quit smoking. And we just basically try to understand what are the challenges for making those changes and help them come up with strategies to be successful.
Gotcha. And so today, our topic along those lines is about how lifestyle medicine can help people manage or even prevent their chronic conditions. Elizabeth, can you tell us a little bit about what consists of lifestyle medicine?
Yeah, sure. So the actual college, the American College of Lifestyle Medicine, is relatively new. It was formed in 2017, but healthcare providers for date back forever almost have always promoted healthy eating, physical activity, and some of the principles of lifestyle medicine. But what it really compromises of is looking at 6 different pillars of health, and using evidence-based therapies or interventions to help people get at the root cause of a lot of the chronic illnesses that we're seeing today at high rates, like high blood pressure, heart disease, diabetes, prediabetes, sleep apnea, or obesity. And so the 6 pillars encompass diet, physical activity, sleep, relationships, stress management, avoidance of risky substances, because all of that plays into how well our body is able to function and prevent or manage some of the chronic illnesses.
Right. And Rebecca, who are your typical patients at the Prevention Center and what do they come there for specifically? I know you touched on this a little bit earlier.
We will get referrals from a lot of different places around the Rush system. So, for example, we get a lot of referrals from the sleep center. There's a lot of patients who've just been diagnosed with having sleep apnea, and they're very motivated to be able to address that sleep apnea. And there's a relationship between that and weight. So if they can lose weight, they may be able to get off of the CPAP. That's the hope. So we'll be referred by different specialty clinics. We also get a lot of referrals from primary care. So maybe in their discussions, their blood sugar levels have been starting to creep up, or they're seeing their hypertension creeping up. And so these will be people who are interested in addressing it through lifestyle changes, like Elizabeth mentioned, changes to sleep patterns, to diet, to exercise, stress management. So I would say primarily, most of our patients do have an interest in weight loss as a component of improving their health, but there will also be a lot of other focuses as well, like preventing diabetes, preventing hypertension, and in general, improving their health. And then also, I'll get some referrals as well for people who maybe there's emotional eating or binge eating as one of the components, so that we can work on those patterns in specifically as well.
Gotcha. And so this next question is for both of you, but we'll start with Elizabeth. Where do you typically start when you begin working with a patient?
Sure. So, like you would experience a lot of times when you go in to see a healthcare provider or doctor, nurse practitioner, we start with a chief complaint or asking, what brings you into the prevention center today? And I get a wide variety of answers from that question. It may be very specific of, I've gained weight during the pandemic and I want to lose 25 pounds. Or I had blood work recently from my doctor and my cholesterol's high, or I'm pre-diabetic. Or I get some people who come in and say, I don't know why I'm here. My doctor told me to come. So it's a wide variety. And we start with where they're coming in, what their reasonings are. And then we do a pretty extensive health inventory kind of questionnaire. That's why our first visit is an hour. And we'll go through medical history, family history. We'll look at their blood work, and then get into weight history. What was your weight as a child, growing up, now? And then getting into those lifestyle pillars where we really look at the details in diet, physical activity, sleep, our stress management work, because like I said, all of it plays. And then we look for opportunities of where we want to focus on our plan of care. So that's where we typically start in our first visit.
Rebecca, did you have anything to add to that?
I would say my first visits are very similar. It's really trying to get a good comprehensive overview of what's going on with this person, what their concerns are, and particularly trying to get a good sense of like what their daily patterns are like, what their daily life is like, so I can understand where we might start to make some changes. And then if it's appropriate, I may also ask some questions about mood and anxiety and eating patterns and things like that as well. With a lot of people, that's not really something we go into in depth, but a lot of times there is a relationship between the two. Maybe some anxiety is actually making it hard to stick with the lifestyle changes that this person really wants to make. So it's really important to understand those relationships.
For sure. And Elizabeth, what kind of support do you offer patients once they've shared their history and what's bothering them?
That's a good question. And honestly, it all depends on the patient, and it all depends on what they need. So after we go through everything of the health inventory, and we talk about, what is their health goal, what do they want to achieve, and why, the importance of why they want to achieve it, then again, we'll look at those opportunities. We'll talk about what's the recommendation, or we'll talk about areas where a lot of times, people will come in and they'll say, I know my issue might be sweets, or it might be sugar sweetened beverages. But, we support them by starting with collaborating and coaching and determining what our first focus is going to be, what they want to try to address first. And a lot of times we'll set a SMART goal, which it's going to be specific, measurable, attainable, relevant to their overall goal, and then timely or time sensitive. And having something tangible and objective like that can help them to start to make those behavior changes. So we'll do that. We'll offer, I have a plethora of resources from the American College of Lifestyle Medicine on, recipe books, websites, Instagram sites, videos, you name it, we've got it. We'll share that. It's basically whatever the patient needs. Two other things that I often like to share with patients, especially in the beginning, are if anyone in Illinois has a link card, then there are resources in the city and beyond that have in farmers markets, they have a lunch program and other programs where when you're buying fruits or vegetables, they will match up to a certain amount, say $25, where they can buy, spend $10 or $20 worth, and then they match that for the fresh fruits, vegetables, produce. So I like to share that if, a barrier might be cost of eating healthy, or for physical activity, we'll share ideas from YouTube, or we'll share free apps. And also the Chicago Park District. If you live in the city of Chicago and you meet the criteria, a doctor or healthcare provider, including myself, can write you a prescription for a membership that you could utilize their facilities for free for 3 months. So anyways, we have all of this information that we just love sharing and trying to support, and whatever we can do to help the patients meet their health goals, that's what we're here for.
Right. Rebecca, one of the reasons you brought up for coming to the Prevention Center earlier, weight management, can be tackled from a number of different angles. What are some of the ways that you try to help patients with their weight management?
So we'll often focus in a few different areas. For example, focus on behavioral changes, changes in thought patterns, and also managing stress. So when it comes to behavioral changes, that's probably very similar to what Elizabeth will do as well, where we will really look at their daily patterns and think about where can there be some changes made, how can we make those changes. And often it will be about starting small, finding some small changes that can really make a difference. For example, a lot of people drink pop on a regular basis, and they may not realize that one pop a day actually is equivalent to about 15 or more pounds over the course of a year. So if we can find some small changes, that often helps people, because it can be overwhelming to think about making all of these different changes in your lifestyle at once. If you can find some small places to start, we can build some momentum. Another place that I will especially focus in on would be thought patterns. So these are often, our thoughts play a big role in being successful, even just our definition of success, because when you are trying to change your lifestyle or you're trying to lose weight, there's going to be lots of ups and downs along the way. And a lot of times people think, I'm just going to make this one change, follow this diet, and I'm going to stick to it forever, which is never happens, right? And so we'll see things like all or nothing thinking patterns, where either they're on the plan or they're super off the plan. And we're trying to challenge those thought patterns and say, okay, maybe you overate this afternoon, but you don't have to wait until Monday. You could have a nice meal for your dinner, and just get right back on track. So we want to challenge those patterns. Or another thought pattern that's very common with our busy, stressful lives is, I deserve it. I deserve this treat. I need this treat. I also hear that a lot too.
Yeah.
And so maybe helping people think through, well, maybe that's true. You certainly can have that, but maybe there's other things that you really want for yourself that you deserve as well, that by changing those patterns, you could be able to have that in your life. So we really want to understand those thought patterns. And then something that I think sometimes people overlook is the role of environment. Our environments have a big influence on us. For example, if you get a dog, suddenly you're going to be walking more. And it's not because you suddenly decided to walk more, but because your environment changed. If you can put the food, like the snack foods, up on a high cabinet or down in the basement, that's going to change your environment, and it's going to have an effect on your behavior. So we also want to look for as many changes that we can make to the environment as possible.
Piggybacking off of those very useful tips, Elizabeth, what are some everyday tips around diet and exercise that can help most people?
Sure, yes. And, Rebecca and I think we've already touched on one of them is, in this country, the sugar-sweetened beverages are kind of, would we call it, a low-hanging fruit of things that it's not providing any nutritional value, but it's a lot of added sugar and calories that if we are able to cut it out, it can make a really big impact. So trying to cut out the sugar sweetened beverages, even, I'll have patients come in that they switch from soda or pop to green tea, and they buy big tea, not realizing, not looking at the nutrition label, that green tea has almost just as much sugar as a soda. So the unsweetened green tea, much better choice than sweetened. But anyway, so cutting out the sugar sweetened beverages, increasing our water intake. Our metabolism also is more efficient earlier in the day. So get our nutrition in morning, afternoon, early evening, and not eat late at night. And that's going to help with both our waistline, prevention of diabetes, and overall health. The other thing is, just really, as much as we can, cutting out the ultra-processed food that is really kind of taking over our food industry and our food supply right now. The more whole food, plant-based fruits, veggies, nuts, seeds, beans that we can include, that will help with our overall health and prevention of the chronic diseases. And also, look at the nutrition label. Start practicing. I'll go over that a lot with patients, is how to look at the nutrition label, looking at the serving sizes, looking at the sodium content, the added sugar content, because so much of our food nowadays, you look at yogurt, peanut butters, almost anything, we want to pick the item that has the least amount of added salt or sodium and the least amount of added sugar. Those are dietary ideas. Physical activity, I always say, I think Rebecca mentioned this before, but start where you're at, right? Start small. If you have chronic illnesses or other conditions, speak with your healthcare provider before starting any physical activity routine. But walking is a fantastic cardiovascular physical activity. It doesn't have to be anything fancy, but doing something that you enjoy, finding a workout buddy to help you stay engaged and motivated when you have those days that you don't feel like doing it. And again, like if somebody comes in and says, I'm not a gym person, I don't like walking on a treadmill, I'm not going to say that's what you have to do, because you don't. You can dance, you can swim, you can do so many other things, but the recommendation is to, at minimum, 150 minutes per week of moderate physical activity. So that's, brisk walking, riding a bike, swimming, and then 2 days a week of strength training using small weights, resistance bands, body weight exercises. And that's really key. I feel a lot of times people will focus on the cardio, but the strength training is important, because as we age as adults, we tend to lose muscle mass every year that we age. And so counteracting that with strength training helps maintain the muscle mass, which is good for bone health, and it's good for our metabolism, because our body's able to metabolize blood glucose better and prevent diabetes. So having that strength training routine is important as well.
For sure. And to kind of piggyback again on what we were talking about a little bit earlier, from my own personal experience, I know that it can be difficult to get going and stay motivated when it comes to someone's personal health and weight. Rebecca, what are some ways that people can continue to find motivation as they go through things?
I think this is really a key issue because, in fact, I might not even call it motivation, but ambivalence. Most people who we see, they are motivated. They have a lot of reasons why they want to change, and they very much value their health, or else they wouldn't be in the room with us. But there's also reasons on a daily basis that keep them from doing the change, and that create that ambivalence. So, maybe you're very motivated to prevent diabetes, but on a daily basis, you have a long work hour, you come home, you're really tired, so you want to go for something really convenient. That actually makes sense in the short term. It's just in the long term that it doesn't really make sense. And so part is recognizing the difference between short-term rewards and long-term rewards. Those short-term tend to win out over long-term. So one of the goals that we have is to try to really make the long-term as present as possible. So maybe we will really get in depth of what your vision is, why this is important to you. Try to make it as close to you as possible. And then you could write it down, what all your reasons are for making these changes, and read it every day so that you can keep it more front of mind and bring the long term into the present. Also kind of acknowledging those short-term things, recognizing, okay, it totally makes sense for me to get something convenient when I come home. What could I do to change that pattern? Maybe I
Mm,
have a healthy option that is super convenient. Maybe I, for the time being, maybe I do healthy choices like a frozen meal when I get home, or maybe I will do some meal prep on the weekend. So recognizing what are those short-term reasons and coming up with creative solutions to work with them rather than trying to pretend as if they weren't having a big influence on you. Um, and and I would just say another thing would be sometimes we wait to be motivated, and actually a
mm,
lot of motivation comes from taking action. So it comes back to those identifying those small actions that you can take and really trying to take them even when you're not feeling motivated, because that's going to build your motivation. I see too many people come in and say, I'm just not motivated, I can't do it. But if they were to, let's say, walk to the end of the block every day for a week, they would so often will start to build that motivation from doing that small action on a regular basis.
right. Definitely starting small is the best part. So along those lines, and again, touching on something we've talked about before, it seems inevitable that people are going to have an indulge in an unhealthy snack or drink from time to time. How do you support people when they try to get back on track, Elizabeth?
Sure, that's a good question. And I'll often give some anticipatory guidance in our first visit even, just letting them know it's to be expected. We're human. We're not perfect. And we're not going to be. We can allow some of that wiggle room to, holidays are going to come up, birthdays, vacations, stressors where we may fall off track a little bit. But what the key is recognizing when you have fallen off track. And I tell people a lot of times, just get back to the basics. What has worked for you in the past? Start maybe tracking your food again, writing down, seeing where there's opportunities, focus on a couple small things to change. And then since you've done it before in the past, that's more motivation and encouragement that you can do it again. And then come back and see us. Sometimes, I hope this isn't the case, but, sometimes people think like, oh, I shouldn't follow up because I haven't met my goals or I've fallen off track. But that's exactly when you come back. Trust me, there's no judgment here. We are here to support you in the journey, and give yourself some grace when things happen, because life is going to happen. And we're here to support you.
Absolutely. And stress and anxiety are super common contributing factors to a variety of health problems. Rebecca, what kind of tools do you provide patients to help them manage their stress?
We'll start by understanding what's happening in your body and what's happening with your thoughts and feelings when you're experiencing stress and anxiety. And then often we'll focus on some action-based tools, like for example, if you change your breathing pattern, for example, simply slowing down your out breath can help your body go into the relaxation response. And so we'll focus on some small things. Often I'll do some meditation practices with patients. So these are actions that they can take to help themselves manage stress directly. We'll also focus on, well, are you having thought patterns that are increasing your stress? Life is stressful, but then often our thought patterns are making it even more stressful. So trying to
Mm,
look for opportunities to change how we think about things, and be less affected by those day-to-day stressors that are happening. And then also sometimes it'll be about boundary setting, getting some practice saying no to things or asking for help when you need help. That can be really tough to do. So we'll be practicing it together and coming up with ways to be able to do so. So hopefully we can change some of the stressors that are changeable.
So we have a couple questions from the audience. These are great. The first one is, what's the most effective treatment for stress eating?
I would say I will always look first at eating patterns actually, because a lot of emotional eating happens in the context of what we call chaotic eating. So it's not
Mm,
really having a very regular eating pattern. Things are not very well defined, meals and snacking. So the first step, usually I'll focus on trying to get onto a regular eating pattern. And often the stress eating will be so much more manageable when that's happening. Um, but in addition to that, we can use cognitive behavioral therapy. So understanding what are the thought, feeling, action patterns that are happening with stress eating. So what are the triggers? What are the thoughts that are happening inside your head that are causing you to feel stressed? Or it could be a lot of different emotions that are causing the eating. And then what are different actions that you can take to manage those feelings that don't involve eating? Um, so that's probably the go-to approach.
Elizabeth, do you have anything to add to that?
I was just going to say and I heard this on a health podcast recently, but I liked it. It's a similar concept, but really checking in, taking a moment to pause and see how you feel, and then recognize if you can recognize that you're stressed or whatever feeling you're having, and your responses to typically eat. If we can take a pause with that and try to interject a different activity that can give you that same stress relief response without offsetting our health goals, like maybe take a pause and go for a walk, or call a friend. I have patients who, they're like, I'm chewing more gum and I'm drinking a lot more water, just to interrupt that pattern of walking to the pantry. So similar concept of what Dr. Wilson said, but it's helpful.
Gotcha. And along those similar lines, we received a question from the audience asking what you think of the apps like Noom, Noom, for those who aren't aware, that are try and help people with weight management and stuff like this.
So Noom is interesting. It's actually based on a lot of the same principles that, like, from the cognitive behavioral therapy approach. So there's a lot of overlap in what people learn through Noom and what they would learn working with myself. So I've had a few patients using Noom, and they really seem to benefit from it and like it. So, and what I like too is that you can use it like as needed, right? It can really incorporate into your life, and that's one of the important things when you're making lifestyle changes, that it actually incorporates into your life on a daily basis. So any tool that works for you, that you find encouraging. A big part of Noom is tracking, and tracking is so helpful to really make our unconscious patterns very conscious. We can become much more aware of what's really going on. So any tool, not just Noom, there's also tools like MyFitnessPal, Lose It. These help you become much more aware of what's going on. I'm a big believer in what works for you is going to be like, just keep doing it, if it's helping you.
For sure. Elizabeth, anything to add there?
I definitely agree, because I've had some patients use Noom who really love it and were really successful. On the flip side, I've had patients that they didn't find it as useful. So that's what it's all about, is finding what works for you, and if it works for you, then that's great. But there are a lot of great apps and tools out there that assist in some of these lifestyle changes.
For sure. Well, that's all the time we have for today, but thank you, Elizabeth and Rebecca, for joining me. And thanks to everyone who watched and participated in some way. Please visit rush.edu for more information, and stay tuned for more live broadcasts from Rush. Thanks, everyone. Thanks, guests.
Thank you.